Hi everybody, this is Ian Smith here. I wanted to discuss with you an idea I had, how to get the economy back, how to get everybody going again, and essentially how to solve this problem using engineering and logic. And my background is both in engineering and as I'm a surgeon and doctor. So I want to give you a little bit of background. The thesis is essentially we could mass produce reusable masks with HEPA filters, and that's the single easiest way to save lives and get the economy back. Engineering has already found us a solution to a severe respiratory pandemic. It's basically filtering the air for every single person. If we want to be mobile, we need to be able to have our own personal HEPA filter. This week, Science featured a recommendation of China's lead health scientist, equivalent to basically their CDC, telling us we all, as Americans, need to wear masks. This dialogue has changed a lot since the Surgeon General told us to stop buying masks. The masks work because it protects the people who are around you from your cough, your sneeze, your talking and spew of the virus. And so it's a herd type of immunity that you get in protection when everybody has to wear these. It's a lot better than everybody being quarantined. If we're going to take this to a logical extreme, we should be making these 99.97% protective masks using reusable HEPA filters for essentially everybody in our society. These are engineered to do this. They're engineered for reuse. I told you that we've changed a lot about our thinking this last week. There's websites out there, Masks Saves Lives. I think the most important thing I've come across is this from Medscape that Cochrane reviews say the single biggest thing besides screening and quarantine and social distancing, that masks in a meta-analysis was actually the safest, most consistent and comprehensive measure to keep people safe. You see the no masks in different countries that wear them. Personal background, I didn't know what a PAPR was at all probably about 10 days ago. But essentially, it's a personal air purified respirator. It's your personal HEPA filter. All you need is 4 components. And I'll go over those in a second. But we found out recently that physicians in my field were dying at a really high rate because they were exposed to high viral loads that were in the nose. And so they had recommended that everyone use these reusable N95s, also known as personal air respiratory devices. I would also further state that essentially the idea that we're asking our doctors and nurses to reuse N95 masks is incredibly inadequate and dangerous. These things are only 95%. They aren't designed for reuse. If you reuse Dawn and Doff or something that's not reusable, it's dangerous. You can contaminate yourself. They're uncomfortable. We simply don't have any. We know hardly any hospital has any more than just one for the most important providers. They're wasteful, not designed for reuse. One of these personal air purified respirators, personal HEPA filters, can be used hundreds and hundreds of times. This could only be used, N95s can be used once, so the estimates are that we'll need millions, which sounds more logical to you. Each hospital has 100 of these, or we get a million N95s. In terms of discussion, the masks, these personal air purified respirators are essentially designed for serious respiratory risk, whether in healthcare or other industries. The design is very, very simple. It's just 4 things: a mask, a battery, a motor, and a filter. The designs vary between basically on the backpack or on your belt. And then they have full masks or open masks, which I had a picture earlier of an open mask, which is a little bit more comfortable. Each has its advantages. We already make at scale hundreds of millions of cell phones and DVD players and stuff. This is a simple device. All it has is a battery, a motor, a mask, and a filter. That's all we would essentially need. I think we should try to produce as many of these as possible. I think if these were used society-wide, people would feel safe. If someone coughed and they had this on, you wouldn't be worried at all. And if you had your own on, you'd be double not worried. These protect and have high levels of filtration. And I think essentially, if we could just get tens of millions of these made as soon as possible, we could all go back amongst our normal lives. This is something that would be normal in the 1950s or 60s. The idea that we could be subject to chemical warfare. This is a viral version of biological warfare, if you think about it. In terms of my rationale, again, I mentioned it's not feasible to use $3 to $12 masks one time. They're not designed for that. Reusable HEPA mask systems can be mass-produced, universally used. I would think any small manufacturing facility could make these. If everybody had these, the American economy wouldn't get shut down. People could go back to their GM factory, Tesla factory. If everyone was required to wear these. Again, I mentioned this would be normal idea in the 1960s. For the first time since this started, I actually have a little bit of hope. If we could just get these produced, we would allow anyone wearing this to be outside. Otherwise, they wouldn't be allowed. In terms of distribution, I think you would do risk stratification. First, you'd have doctors, then nurses and other healthcare providers in hospitals, then first responders, and then those providing essential services, such as grocery store workers. The elderly and the health compromised could walk outside knowing everyone has these on, they're protected. They themselves would be protected. They'd be protected against the respiratory secretions of other people because they would be required to wear them. You could just deploy these in certain communities at certain times when you know there's a pandemic. This would give freedom. People could go back, get outside, be safe, a lot better than a quarantine.